All right, it's again my pleasure to introduce our second candidate, Dr. Michael Brady, who's Associate Medical Director at Nationwide Children's Hospital. He's Professor of Pediatrics at The Ohio State University. He was born in Wilkes-Barre, Pennsylvania, and had early introductions to medicine through his father, who was a family medicine physician, and his mother, who was a nurse. Both parents were role models, showing him the challenges and rewards accompany providing care and service to those in need. He and his wife, Jane, of 40 years, have two children, Tom and Kate, and two grandchildren, Ruth and Knox. Graduating from the University of Notre Dame and Jefferson Medical College, his training included pediatric residency at Nationwide Children's Hospital and pediatric infectious disease training fellowship at Baylor College of Medicine. Following fellowship, he joined the pediatric infectious disease faculty at Nationwide and focused on infection control and HIV. His notable accomplishments included developing a family-centered HIV program recognized by the federal government in 2005 as a model that works. He was chair of the Ohio State Department of Pediatrics from 2005 until 2013. He's been active at the AAP at the national and state levels, serving on the section on infectious disease, the Committee on Pediatric AIDS, and the Committee on Infectious Disease, of which he was chair in both, from 2010 to 2014. He has been the associate editor of the 2015 as well as the 2018 Red Books, and assisted the Ohio AAP with improving HPV immunization rates and with legislation improving immunizations of children in child care. His teaching awards for medical students at OSU and nationwide pediatric and family medicine residency programs are personal points of pride. He received the Leonard Tao Humanism in Medicine Award from OSU, as well as Tom Dooley Award from Notre Dame, for an alumnus who has exhibited outstanding service to mankind. Welcome, Dr. Brady.
Well, good morning. So I'm truly honored to be given this opportunity to be one of the two candidates for president-elect at the AAP. And after hearing Bernard's speech yesterday, it was very humbling. So I appreciate what really goes into this position. Sarah mentioned some things, but what leadership skills do I bring to this? Well, as she mentioned, I was the chair of the Department of Pediatrics at Ohio State. While I was there was 460 faculty, but one of the important things for people to understand is I had 90 primary care pediatricians in my department working at 13 inner-city medical homes. And it was very clear, Olivia Thomas made me understand what the issues were that were important to primary care pediatricians. And as was mentioned, I've been very fortunate to have a number of leadership positions within the academy that I've enjoyed tremendously. I've also participated in the Medicaid ACO at Nationwide Children's Hospital, which has been available for about 14 years, where we've been able to actually learn how to use being at risk and understanding finances to not only do cost savings, but also to improve care. And I can tell you that we've been able to reduce the length of stay in our NICUs by 25%. We've been able to reduce asthma ER visits by 50%, and there's a lot of things that I think that we can do in the future of trying to improve care as healthcare financing changes. We've been learning all this meeting about the impact of toxic stress on children. And one of the things that is very clear to me is that the root causes of much of the toxic stress, poverty, violence, homelessness, poor education, are not under the direct control of pediatricians, even though we see the impact. It has resulted in epidemics of non-communicable and mental health diseases. So we have some safety net programs in place for a lot of these situations, but they're essential but not sufficient. We need to partner as an AAP with some unique organisms, possibly, that actually have a much greater opportunity to be able to impact these root causes. And having 66,000 pediatricians put their support behind these measures, I think that we can actually start having an impact on these root causes. I would be very disappointed if somebody 20 years from now is still discussing that we have 20% of children in poverty. And one of the things that I think the AAP needs to start working on, because in my belief, is that the most important issue to try to help people get out of poverty is to ensure that they have a good education. And I truly believe that there are too many children that have been let down by our education system, and I think the AAP should have a role in trying to define what the education system looks like in the future. People have been talking about physician wellness. Pediatricians are not burdened by taking care of patients. That's why we're here. We love it. The AAP needs to continue to develop programs that assist pediatricians and who are experiencing burnout. We need to start addressing things. Colleen mentioned, but at the board meeting, it's clear that the ABP is hearing about some of the concerns from pediatricians about maintenance of certification. I think that one of the things that would be very valuable would be for the AAP to develop a partnership with ABP. They are thinking about going towards annual dues. AAP already does that. If we developed a partnership, we might be able to act a little more synergistically rather than antagonistic in order to make maintenance certification the system that really does provide evidence that pediatricians are maintaining their competencies, but also is done in a manner that would be much more valuable. One of the things we could offer people who join both of them, a slight discount, that would advantage the AAP because we know there's 20,000 board-certified pediatricians who do not belong to the AAP. We need to find ways to capture them. We also need to continue to try to work on MOC4 so that it is more consistent with what goes on. And as we start having more and more metrics being put down on top of pediatricians' already busy schedules, we should have the opportunity to use what pediatricians do in their offices either to meet the metrics or to sustain meeting the metrics, because fortunately most of the time they already do, as part of their MOC4. The other thing is I think the AAP needs to partner with other organizations to try to see if we can have an impact on these increasing medication costs. This is one of the major problems that we're going to face in the next couple of years because it is very damaging to our patients. The next thing I'd like to talk about is the medical home. Healthcare financing is going to change. The AAP needs to make sure that the medical home is the centerpiece of any effort to try to address healthcare financing. And we probably need to work with the AAFP and ACOG and ACP because we need to have more leverage to try to get people to understand the value of primary care pediatricians in the medical home. But the medical home needs to expand. Maybe all these services can't be done in one building, but I think we need to have clear connections, and telehealth might be able to help. We can create a digital medical neighborhood, mental health and behavioral health, nutritional support, developmental evaluations, home visitation, social service connections. And these are key, I think, because many of our families are having issues that are created by social determinants of health, but they impact our ability to provide them care, and social connections help. Schools. Children spend a tremendous amount of time in schools. We need to be able to use that as a way to help them identify issues, but also there's things like the PACS Good Behavior Game, which has been shown to reduce ADHD referrals to pediatricians by 30% when done correctly, and the Signs of Suicide curriculum, which has been used to try to identify much earlier when children have depression, because again, they're in schools and people can see them a lot more. Medical home always need to have the pediatrician as the captain of the ship, and that has to be clear. And the pediatrician should drive the payment, not have the payment drive the pediatrician. And the pediatrician should be allowed to have as much time to do what's right for their patients and not be driven by having coding or other things determining what goes on in their offices. And I think that we can show that if you do that, it's a much more cost-effective model. And I've talked to Mary Applegate, who's the medical director of Medicaid, and she is very, very supportive of trying to enhance payment to primary care providers as a way to provide more cost-effective care. I think we need to engage young career pediatricians, and this will help us increase AAP membership. We have to start early during residency, and I'm so happy to see so many residents here. We have to find out what's really important to them, because what's important to them may be different than what's important to us. We need to have a sliding scale membership dues. These residents are coming out of training with debt that is just astronomical, and it's very difficult for them to take a look at the dues and say, I don't know if I can do that. We have to be able to understand, if you get somebody in the AAP for 5 years, they're going to stay. We have to be persistent, and we have to try to figure out how to address providing leadership opportunities earlier, and we may also have to be a little bit more kind of innovative, because many times expectations from the AAP, either at a local, state, or national level, require a lot of time. So we may need to have people job sharing if they're doing something on a committee, and utilize other types of resources. And I know the new building is going to have lots of opportunities for digital communications. So finally, what I would just like to say is I really do think that we need to kind of address the issues that children have, and many of them are not necessarily under the control of pediatricians, so we have to develop the relationships with the groups that can, and put 66,000 pediatricians behind that. We need to expand services in the medical home, and we need to make sure that pediatricians are, again, defining what the medical home is and not having other outside agencies. And finally, on November 8th, just remember to put kids first and vote kids. So thank you very much.